Good evening, all. Welcome to this webinar. I welcome each one of you joining us today. I'm Preetha Harikrishnan, Deputy Manager, Department of Admissions, Amrita Health Sciences, Kochi campus, and your moderator for today. Thank you all for joining us today for the webinar on the need and scope of cardiovascular technology course. So before we begin, let me introduce you to our guest speaker for today, Dr. Praveen G. Pai. Sir, he's a clinical professor, Department of Adult Cardiology. Doctor has done his DM cardiology from Mahi, Manipal. He's presently working as interventional cardiologist and electrophysiologist in Department of Cardiology at Amrita Institute of Medical Sciences. He has published original papers in both international and national meetings. He's also coordinator for MSc and BSc cardiovascular technician courses. Besides teaching undergraduate, graduate, and postgraduate students in medicine and cardiology, he has participated in several international seminars too. I lovingly welcome you, sir, to address our attendees today. Welcome, sir.
Thank you. Preetha, shall I go ahead with the presentation?
Of course, sir, of course.
Thank you, thank you. Is my screen visible?
Visible, sir.
Okay. So thank you all for joining for today's class on this basics of BSc cardiovascular technology. I will just go through the curriculum of BSc cardiovascular technology, and if you have any doubts, you can ask me after that. So, Bachelor of Science of Cardiovascular Technology is an undergraduate course in the Department of Cardiology, where we help trainees to assess the diagnosis and treatment of cardiac as well as peripheral vascular diseases in both adult and pediatric patients. BSc Cardiovascular Technology is a 3-year full-term undergraduate course after the +2 and is an interesting and important course in the Department of Cardiology. The technologists monitor the patient's cardiac parameters while they undergo certain procedures, both in the inside as well as outside cath lab. Outside cath lab, they have major role in non-invasive. Non-invasive means without any introduction into the body. Some tests like electrocardiogram, echocardiography, TMT, Holter, and HUT, etc. And during the invasive testing, which we call as cardiac cath lab, for the treatment of various conditions in both adult and pediatric and heart diseases. The minimum eligibility criteria to get admission for this is 10+2 educational science system, physics, chemistry, and biology, or equivalent from a recognized board. A minimum aggregate of score of 60% at the 10+2 examination is a must for entry into the course. Students who have taken a vocational system of stream of education should have compulsorily completed bridge course in physics, chemistry, and biology, because the training here is mainly based on the physics, chemistry, and biology. So if you have a background in these subjects, it will be easier for you to understand. Candidates are selected based upon the entrance examination conducted by the Amrita University, and you should have certain skills for this course. The cardiovascular technologist is responsible for assisting physician in both inside as well as outside cardiac catheterization laboratory. They aid in the prompt diagnosis and treatment of diseases pertaining to the heart and blood vessels, and they have to maintain the health of the heart in terminally ill patients. So some people, subjects who are interested in the physics, chemistry, biology, as well as who are interested in patient care, both inside and outside cath lab, are required for this. They should have a good knowledge in operating the different equipments used in cardiovascular technology, and to efficiently perform the function, they should have the following skill set. They should assess the clients that for the heart-related problem, monitor and care for those who are suffering from cardiovascular ailments, and have good knowledge in the medical equipment and tools to use. These all will be trained by us in this department. The only thing is that you should have a skill, or you should have a skill to see that, learn from each other as well as apply for the patients. Learn and apply the basic and advanced support skills, that is the life support skills. Master the emergency intervention invasive procedures in an attempt to save patients' life. That is common for any hospital-based paramedics. Learn to use and insert catheters in emergency practical setting. Observe and understand the correct way of performing cardiac procedures before practicing them. And and they should be having a communicative skills, as well as they should be effective team player, because everybody is working as a team. So everybody is also important as a team, and this is more than important. As I told you, the course is for 3 years, and after passing the examination, 1 year compulsory internship, where they will be posted in the cath lab for the assisting independently simple as well as complex intervention procedures in the cath lab. So by doing the BSc cardiovascular technology course, you will be students will be exposed to both invasive as well as non-invasive methods of treatment of various cardiac problems, and they will be able to handle the cardiac conditions, or assist the cardiologist in specific areas. The course curriculum is based upon, there are three it is a 3-year system, where first year they are basically studying anatomy, physiology, etc., and cardiac technology. This is almost like a small part like an MBBS students. And year-wise split of the curriculum is, as first year anatomy, physiology, and cardiac care technology. Second year it is non-invasive, and third year they will be posted in the cath lab. Fourth year, which is after passing the degree, they have to do 1 year compulsory internship, where they will be exposed to various. They will have to do the duties, as well as they are exposed to do the procedures by helping the cardiologist. Now, this is the first year anatomy, physiology, biochemistry, microbiology, quality and assurance, as well as computer science. So they have the basic skills of what is happening inside the body. Second year, pharmacology, pathology, cardiac anatomy, physiology, and cardiovascular technology. Again, the basics of diseased heart, as well as how the disease affects the various individuals. And third year, it is the cardiovascular technology, advanced, applied, as well as then the thesis work occurs. And they will be exposed to in the practical examination. They will be exposed to in the first year to the ECG, TMT, echo, etc. Again, with the cath lab comes in the third year, and internship they will be in the cath lab for 1 year. So this is the basic structure of the course. I have told about the basic attitude, basic knowledge which is required, and what is expected of you. And these are the various equipments which are. This is a treadmill test, where patients are made to walk, and we assess the cardiac function. This is the various echocardiography lab, where scanning of the heart, both adult and pediatric, we do. And this is the ECG lab, where electrocardiogram is taken for both adults as well as congenital heart disease. And this is our cath lab, where interventional procedures are done. We have 3 cath labs. So all the 3 cath labs are required for diagnosing as well as for the therapy of various cath lab procedures. Now I will
It's not so loud for them to hear, sir.
okay, I will make.
Complex pulmonary angioplasties, which involves a combination of TEC, IAP, and TEC. Not only that, we have also successfully completed transcatheter valve management. Recently, we had transcatheter pulmonary valve management for procedures in the room. We are exposed to radiation on pieces, since we use X-rays for the one form of interventions. But our hospital providers then copy even on others for radiation. As an India, I and they have safely done something that
So this was an intern who a girl who had passed BSc cardiovascular technology course last year, and 1 minute, I'll just pause. I wanted the parents to know that what we are doing here. The first person who was speaking to you was an intern. She was an intern last year. She got a job opportunity in Care Hospital, Hyderabad. She got a good offer there. She is studying that, and she is also doing a super specialty from that hospital. She left us 3 months back, and she has joined Hyderabad. So I just wanted you to learn from this girl who is going to speak. She was a final year student. She is an intern now. So we'll hear from them.
So she's also not loud. I think you can start it once again so that they can hear from the
Okay,
beginning.
I'll start from the initial part.
Yeah. Still not audible, sir.
Oh, okay. This is the maximum, which is
Anyway, I think you should be telling us what she has told anyway.
sure, no problem. Now, next is I think we'll learn from
Even he is not audible.
Okay. I think there is some problem with the system though, because here it is well heard. We'll explain to them.
Okay.
Basically, I will stop the presentation here. Basically, what they were telling was their experience as well as the way in which they were able to initially adapt to the course, and then they came out successfully. Most of the students, almost 99% of the students have got very good marks and they have gone abroad. Only one or two students only had to change the subject because they thought that the subject was not up to them, and then they had to change. Rest of the all students have got very well. And if I will stop here, and if you have any questions, I will be happy to understand. Thank you.
Uh, Thank you, sir. There is one question asking what is the difference between CVT and cardio care technology?
If Rita, if anybody
Yes,
there,
sir.
can you?
There is a question.
Ah,
Is there any, what is the difference between CVT and cardio care technology?
See, the different hospitals are conducting the course for cardiology in a different way. What the courses under cardiology department here is cardiovascular technology, where the students will get exposed to ECG, echocardiography, treadmill, and Holter hut, as well as cath lab. There is another course which is called cardiovascular echocardiography, which is only for an echocardiography. Some hospitals do the same course as cardiac care technology. So it is only a difference in the words, as well as the only thing is that you have to see what all exposure, where all the students are exposed during the course. That is the only difference.
Okay. So, sir, now why should our candidates choose Amrita?
Uh, that is because, see, in Kerala, we have started this course in around 2002 when the Amrita Hospital, the cardiology course started. And when the department started, after 2 3 years, we started the cath lab technician course. And from that period itself, we were able to train students because of the volume of work which we are doing, as well as the various specialities which are associated with it. In Amrita, we have in cardiology department, both adult as well as pediatric cardiology, intervention cardiology, cardiac care physiology, as well as electrophysiology. So the cath lab technician students are exposed to all the different modalities, and then they get a very good opportunity to learn or practice them in their future. So I feel that it is a good institute to work with if you provided you have an affinity that students to understand, because when the third year, only thing is that I am sorry for that volume of that video, because here we were able to hear it very well, but somehow when this through the this one, the volume has come down. I wanted the both the third year per student as well as an intern, and the last person who talked to you was the chief cardiovascular technologist. Now he was a student here, he studied for BSc here, he did MSc CVT, and he's a chief technologist here. I wanted to hear from all three of them, but there was, I am sorry for the volume problem which had occurred. But you can answer me you can ask me any question regarding this, I can answer you.
So there is another question like what are the job options that these students have?
There are, see, job options means that if you pass this examination, there are various ways. You can work as an ECG technician, you can work as an echocardiographic technician, you can work as a treadmill technician, and you must have learned about cath labs. Cath labs or catheterization laboratories are there in Kerala. There are around 140 cath labs from Kasaragod to Trivandrum, rather than going outside Tamil Nadu as well as Bangalore. All the cath labs or cardiac catheterization laboratories will require technicians for doing their routine work, where they have to move the machinery and they have to learn what all procedures have to be there. All these will have to be taken care by the cath lab technician. So when you are studying in a good institute where most of the procedures are done very well, they will be naturally exposed to doing the procedures. I mean, we have some students who study in some other institution, and for internship they come here because they want to have the practical knowledge of it. We accommodate them also, because anybody who comes for knowledge, I think we should accommodate so that they get enough knowledge in them before they go and practice.
Okay, thank you, sir. Now another question is like candidate who has taken BSc CVT, what other eligible PG courses could he apply to apart
Um,
from cardio?
That I think you have to see the prospectus, because in the prospectus there are a number of courses where you can apply. The prospectus which is given by the Amrita Institute of Vishavidom, you have to see and then you have to apply. See, there are different courses in different departments. I am speaking only for cardiology. department. So there are different courses. Cardiovascular surgery has other medical specialties have. So whichever which you have the this one affinity to, you have to go.
Okay, sir, there is another question. Why universities have less seat for this course?
I think we cannot just because the idea is that you should have a good training. So to have a one-to-one training, we should get the best candidates only. It is not that we should open some 50 students where nobody will benefit. We are choosing the number of seats so that we can train everybody, and whoever comes for the course is well oriented and is well prepared for their work abroad. So for that, there should be a quantity control. We cannot call everybody, and the course cannot, because this is only not theory. If it is only a theory course, you can sit in the classroom, you can call 100 people and teach them. This, along with theory, you should have practical knowledge. You should know how to take ECG, you have to do an echocardiogram, you have to do a treadmill test, you have to do Hut as well as Holter. Cath lab, you will have to come and assist. So if for everything, there is a time limit, and the way in which it is limited, we cannot have more than a specified number of students.
Yes. Now, sir, there is again a question like, can the student do a PG for CVT abroad?
I didn't understand this one. I didn't
Like
understand
the candidate has completed his BSc CVT, and now will he be able to do his MSc abroad?
I am not sure what I don't get why should somebody do an MSc outside? We ourselves are having Amrita. I am not boasting. We have an MSc CVT course here itself. If you want to do a MSc, to answer the question of doing an MSc outside, each university will have their basic qualification notified. So you cannot go and do a course outside if the course is not recognized by that particular university. So we have, our students have gone and done courses in UK, Dubai, as well as United Arab Emirates, Australia, New Zealand, etc. But it is not open for all universities. Certain universities, they will have to have a basic criteria where they have to study their English knowledge, etc. So many things will be there. So based on that only, I can answer that question.
Okay, sir. Another one is like, can we join physician assistant course after completing CVT?
No, no, I don't think you should do physician assistant course after doing CVT, because CVT, that is why I told physician assistant course is different. Physician assistant course is you assist the physician in their daily work activities. We have physician assistant course here, but that is different from CVT. So doing CVT doesn't help you in becoming a physician assistant, because the job opportunities, what you can definitely join physician assistant course, but then the way in which you study for 4 years for CVT will be a waste, because that you are not going to utilize in physician assistant course. For
Yeah.
doing the physician assistant course, you should do physician assistant course.
Okay. Another question is there a PhD in CVT?
Sorry?
A PhD degree
No,
in
no, no,
C.
no. No, there is no PhD here, because for both BSc as well as there is an MSc CVT code. For that, you have to have a thesis, and other works are there for publishing and all. So we don't have a doctorate for this.
Okay. So any other questions, candidates, you could raise your hands also. Is there a chance high for the job availability outside India?
Definitely. Our 50% of students have gone outside United Arab Emirates, UK, Ireland, and somebody has gone to Australia, New Zealand, etc. We have a diaspora of students who are abroad. So again, the course is recognized in most of the places where you can work there, but it only depends upon the job availability at that particular period of time. We can't be sure that it will be there at each year, but definitely it is the prospects are there.
Yes. So I think, is that clear now? Any other doubts from your side?
Somebody has raised
Candidates,
hand.
let me just check, sir. Yes, 3 of them. Aki, there is. Aki, are you there? Parvati? Can you hear me? Parvati, Aki, both of you have raised your hands. You can unmute yourself. Dilip Kumar. Yes. Parvati. You can unmute and ask your question. All of them have raised, but no one is answering. Aki,
Okay.
unmute and speak. Parvati, you have unmuted. Can you speak? What is your doubt? Dilip Kumar.
What is the invisible procedure meaning?
Sorry.
Invisible procedure.
That you will learn when
inside
you
the
come
cath
here.
lab.
Invasive procedure is the procedure by which we have to put any catheter inside the body and study. That and all, when you come here, you will be learning. Don't worry.
Parvati.
Is it inside the cath lab, God?
Yeah, it is inside the cath lab.
Any other doubts, Parvati? Okay. So I think then if there are no more doubts, I will, doctor, thanks a lot. I will just ask our admission, Miss Sanuja, who will. Yes.
One more question can I ask?
Yeah, sure. Please go ahead.
For Amrita daily, how many procedures, the heart operations and the procedures?
Sorry.
How many operations in Amrita being done for heart?
No, why do you want to hear that? That has no connection with the course, no? I think we should discuss something which is important for your course. Sorry?
Maybe he
just
just
for
want.
understanding for the
That I don't think that is see, those things are not they should not be told in the public, because there is some ethical there is something called medical ethics where we should not go on posting like we are doing so many procedures and all. I think that question is should not be asked in the particular case, because what is required is whether you are getting knowledge or not whether what we are doing and other things are not need not be discussed in this forum. Sorry, I will not answer that. Any other questions?
That's fine. Now, regarding the salary, doctor, anything you could?
First of all, I will be happy if somebody asked about the way in which you want to know the knowledge and other things. If you are more interested in salary, you will have to do something else rather than studying, because you should be interested in studying. A person who comes only for salary and other things, I don't feel that we will be able to make that person into a good student, because unless you learn well, you will not be able to do well in your practice. Unless for doing well in your aim should be to become a good student, learn everything, and then go out and practice. So if your question from here itself is salary and other things, I don't think the chance of studying is there in your. So salary and other parts we can discuss later. Okay.
Yes. So actually that should be the passion for CVT.
Yeah,
so that is what doctor means.
Correct. Unless you have passion and you should learn, then only you can go for this course. So if your interest is in salary, what are the surgeries done here, what procedures we are doing, then that is a more like a business minded, where your chance of learning well will not be a good. This is exactly the reason by which we want to limit the number of students, because if the number of students are more, then it becomes a business. Here We are trying to get only good students who do well in the examination and who have an aptitude for studying.
Yes,
Don't
that's very
mistake me,
true.
I am telling out of my son, and whoever has done well, I have done very well. They have done the scope very well. They have gone abroad. They have learned well. They are doing very well also. But that should not be the attitude by which you should join. You should join for the passion of it.
Yes, that's true. So I think, Doctor, before we wind, we have Sanuja from the admissions who will just tell us the process that has happened for the admission this year.
Okay.
Sanuja?
Okay, ma'am. I am Sanuja from admission office. Good evening, all. I will just discuss about the brief explanation about the admission process of cardiovascular technology. I will just share the screen. Duration of the course is 3-year plus 1-year internship. And the eligibility of this course is 17 years of age and maximum 23 years as on December 31st of each admission year. And and the candidate should have minimum 60% aggregate marks in physics, chemistry, biology, and English. And the selection is based on the rank obtained in the Amrita entrance examination, that is AWL, and the counseling will be after the allotment of seats. Then coming to the Amrita entrance exam life science, the entrance exam will be computerized online exam. It will be held in the examination centers allotted to the candidates. The duration of the course is 2 hours and the syllabus is based on +1, +2 physics, chemistry, biology, and English. For the candidate will score 3 marks for every correct answer and -1 for each incorrect answer. There will be 25 questions from physics, chemistry, biology, and 5 questions from English. Total 80 questions, and the candidates will get 240 marks. Then proceeding to the fee structure, the tuition fees for scholarship category 1,80,000 per year, and for non-scholarship category 2,60,000 per year. For NRIs, the tuition fees will be 5,500 USD per year. And the other fees and hostel fees is common for both categories, that is 37,450 and 68,000. And the hostel is not compulsory for those who is residing in within 20 kilometers. And the registration for all the UG programs was closed yesterday, that is 13/5/24. On May 15 onwards, from May 15, 10 a.m., candidates have to log into the portal for slot booking and taking the admit cards. The examination date is May 18th, and the slots will be 9 a.m. and 11 a.m. Then second slot will be 12 p.m. and 2 p.m. and third will be 3 p.m. and 5 p.m. The candidates can choose any one of the time slot for the entrance exam. For all inquiries, the candidates can put a mail to ugadmissions@aims.amrita.edu or contact the numbers that already we are given in our website, that is amrita.edu/admissions. And last, Amrita, we do not have any agency for admission to any of our programs. Kindly contact the admission office or the numbers that are given in the website, toll-free numbers and admission office numbers. Okay, thank you all.
Thank you, Sanuja. That was a brief outline. We have finished registration for the courses, UG courses. And tomorrow is a day when all the candidates can select their time slot. And immediately after that, you can download your hall ticket. And then on 18th May, you will be having the Amrita entrance exam. The results would be got within 10 days. And then after that, the allotment starts. So thank you, Doctor, once again for your patience, patient listening, for the time that you spent with us. And even last year, we could have you with us, doctor. So happy that you gave us your time and explained to all these attendees who have come in large numbers today, joined the CVT webinar today. And I'm happy they would all have gotten a lot of information on what they were actually expecting. So I once again thank Dr. Praveen for giving us his valuable time and enlightening us. I thank each one of you who have joined this webinar today too. Thank you and take care.